Good day everyone, I am student nurse Lian Alok from Columban College, and today I will be performing the gowning, which is the donning and doffing technique. And these techniques are being conducted before and after dealing with patients who may have secretion during operation. And assuming I have already washed my hands in order to prevent cross-contamination during the examination or operation, I will now proceed with wearing my gloves. So, now that I am spreading the gown, we want to make sure that while wearing the gown, we don't touch any surfaces around us, because that may cause bacteria to attach to the surface of the gown. So now I am tying. I want to make sure that the ribbon that I'm going to tie is just easy, so that it will be easy for me to remove it after the procedure or examination. And now, for the tie, I want to make sure that it is properly surrounded around my waist, and that there is no visible views from behind. Now, assuming I have proper mask, I will now proceed with the wearing of my mask, but still we have to observe and perform the proper wearing of it to prevent ourselves from contaminating possible sickness from our patients. And using our forefingers, we want to spread from the nose up to the maxillary area in just one direction. And now, for my goggles or face shield, I will now proceed of wearing it just right on top of the mask. There. And since I am using a sterile gloves, I want to make sure that I am properly wearing them. And as you can see, I have now removed the packaging. And I want to make sure that using both of my hands is that I am opening this and not touching any surfaces around it. So I am now doing that, as well as on this. And using my non-dominant hand, I will grab the gloves and wear it on my dominant hand. It's important to make sure that we are not touching the outer part of it, and that the gloves is over the gown. And now the other side, or the other hand. Now I have successfully worn my gloves, and now now that we are done with the donning, we will now proceed with the doffing technique. And for the doffing technique, it's important that we remove first the gloves, because after operation or examination with our patients, these gloves has been mostly contaminated by bacteria or any other possible diseases. So we want to make sure that by grabbing the wrist in the doffing technique, there, and that crumple it on the other hand by grabbing it and crumple it once again. So apologies again, there has been some technical problems on the cell phone. And now that we have removed the gloves, we will now dispose it and perform hand hygiene again. So assuming I have already once again performed hand hygiene, now we will now proceed with removing the gown or untying the tie of the gown. Here, as I have told you earlier, it's important that we just easily tie the tie so that we could easily untie it as well. So just like this. and on the top part. Now, by removing it, it's important that we don't touch the outer part of the gown because it is also mostly contaminated during the operation or examination. There, the gown is now inverted and I am touching the inner part and not the outer part of the gown. And I am folding it inward. So that it is easily disposed. Now, I will remove my goggles or face shield. And lastly, of course, my mask. And now you're ready once again to perform hand hygiene. So that is it for today's return demonstration. I hope that I have made myself clear despite the challenging environment that I am performing in right now. So thank you.